Marian may be the newest hospital on the Central Coast, but to us, healthcare is more than a new building. It's a promise to provide our community with exceptional medicine today, tomorrow, and every day.
Marian Medical Center broke ground on a new $210 million project this morning. The facility will include 188 new patient beds, private rooms, and state-of-the-art equipment. It will feature a new neonatal care unit, an expanded emergency room, cardiac and oncology services, a healing garden, and much more.
In the spring of 2012, Marian Regional Medical Center celebrated history.
Today is truly a monumental step forward in healthcare, not only for Santa Maria, but for the entire Central Coast.
Opening its doors to a remarkable state-of-the-art facility featuring the latest life-saving technology, private rooms, an expanded newborn NICU, critical care unit, and emergency department.
And this is where the magic begins. We are going to provide the best possible health care that we can in a safe and compassionate manner.
But this is more than a new building. It's a promise to you and your loved ones that our highly trained healthcare professionals and physicians from the nation's top medical schools will continue to provide safe, quality, compassionate care.
And because medicine never stands still, neither will we. Thank you.
A new era in cancer treatment began today in Santa Maria.
Mission Hope Cancer Center is our opportunity to serve the community by having all of, or the vast majority at least, of cancer services being provided under one roof.
The 44,000 square foot building is a one-of-a-kind local facility that will provide services currently not seen here on the Central Coast.
Better technology, newer technology, more research, basically state-of-the-art treatment that is difficult to accomplish in a smaller setting.
Well, today marks the start of a new era in state-of-the-art healthcare for the Central Coast. Thanks for joining us. I'm Mark Cotter-Robles.
And I'm Jasmine Veal, and we do begin tonight in this health alert. Medical staff and administrators at the new Marian Regional Medical Center are breathing easier after what appears to be a flawless transfer of patients and equipment from the old hospital into the new one. Keith Carls is on scene outside the sprawling new medical center with a rather touching moment from today's historic occasion. Hi, Keith.
Well, Jasmine, it's really hard to find a more logistically complex and delicate operation than moving patients from one hospital to another, those patients being in various forms of condition. And again, that's exactly what happened here this morning. What I can tell you is doctors, nurses, staff, and administrators worked basically for the last several months to make sure that everything went according to plan. And when it didn't this morning, they had to make corrective steps quickly to keep the entire process moving smoothly and successfully. Now, I'm told that about 100 patients were moved from the old Marian Hospital by 12:30 this afternoon into the new hospital, well ahead of schedule. As you might imagine, some of those transfers were more delicate than others. The new neonatal intensive care unit at the new Marian Regional Medical Center has nearly tripled in size over the old hospital's NICU to 21 beds. And we're happy to report that all of the newborn babies made the move with flying colors.
The first time I bought my Triumph, I was 22 years old. And now, when I turn that key and I see that little red light come on, I'm 22 years old again. If it wasn't for Marian Regional Medical Center, that little red light might have gone out forever.
It was an expert team of cardiac physicians and a heart center ranked in the top 10% nationally that allowed Larry Lavanino to drive on. Marian Regional Medical Center. New and always will be.
From the moment the EMTs got me into the ambulance, they assured me
everything's gonna be okay. Marian's waiting for you.
I had a heart attack. Marian. They realized the importance of time. I mattered to them. In that 32 minutes, everything they knew to do, it worked. Life was precious to me before a heart attack. Life is even more precious now. Marian saved my life.
At Marian Regional Medical Center, quality health care is more than a state-of-the-art building. It's a promise to provide our community with exceptional medicine today and every day. So, why did we build the new Marian? Because 4 months from now, if your baby arrives prematurely, she'll receive the finest in care, minutes from the place she'll call home. And 6 years later, if she falls, she'll see an ER physician without delay from the nation's finest in medical training. Because later in her life, when she hears the words, "You're cancer-free," she'll know the best in treatment and technology is here. And years later, if her husband should need advanced cardiac care, she will rest assured that our nationally recognized heart center will bring him home again. Because medicine never stands still, neither will we. Marian Regional Medical Center, new and always will be.
Our promise to our community is about advancing the newest, most innovative treatments to heal patients young and old. We're always adding the latest life-saving technology and expert healthcare professionals and physicians from the nation's top training programs and medical schools. Because medicine never stands still, neither will we.